You fear your heart because it can stop. You fear your lungs because you can suffocate. You fear your brain because it defines who you are. But there are two organs you almost never think about. They don't beat. They don't breathe. They don't create thoughts. And yet, if they stop working, every other organ slowly turns against you. Subscribe for extreme body science. Right now, at this exact second, your body is producing toxic waste. Not from disease, not from poison, from the simple act of being alive. And only two small organs, hidden deep in your lower back, stand between that toxin and your slow, irreversible death. When your heart fails, you collapse. When your lungs fail, you gasp. When your kidneys fail, you feel tired. And that is why kidney failure is one of the most dangerous failures in the human body, because its symptoms lie. So what does it feel like when the blood that keeps you alive quietly begins to poison you? What happens when the waste reaches your heart, your lungs, your brain, and your body has nowhere left to hide it? This is the quiet death. Act Y. The poisoning paradox. Your kidneys are not backup organs. They are infrastructure. Every single day, they filter about 180 liters of fluid from your bloodstream. That's more than 40 gallons, daily. But here's the critical detail most people miss. They don't just remove water. They separate life from waste. Out of those 180 liters, your kidneys selectively reclaim what you need: electrolytes, glucose, amino acids, minerals, and discard what will kill you if it stays. The most important of those wastes is urea. Urea is not a toxin you ingest. It's a toxin your body creates constantly as a direct byproduct of breaking down protein. Every heartbeat, every muscle movement, every thought, urea builds. Under normal conditions, your kidneys dissolve it into urine and remove it quietly, efficiently, invisibly. But when kidney function declines, that waste has nowhere to go. And this is where the deception begins. Because early kidney failure does not feel dramatic. You don't collapse, you don't gasp, you don't scream. Instead, you feel fatigue that sleep does not fix, nausea without food poisoning, loss of appetite for no clear reason. This is not weakness, this is internal poisoning. Urea begins accumulating in the blood, a condition called uremia. And as levels rise, your body attempts something desperate. It tries to push waste out through the skin. This is why many kidney failure patients experience intense, relentless itching, not allergic, not dermatologic, not external. It is the sensation of toxins interacting with nerve endings because the blood is no longer clean. At this stage, people still function. They still go to work. They still ignore it. And that delay is deadly, because while symptoms whisper, the damage is accelerating. Act 2. The systemic collapse. Kidney failure is never isolated. Once the kidneys stop cleaning the blood, every other organ is forced to compensate, and they fail one by one. The heart, electrical failure. Your kidneys regulate potassium. Potassium controls electrical signaling in the heart. When kidneys fail, potassium rises uncontrollably, a condition called hyperkalemia. This does not cause chest pain first. It causes electrical instability. The heart muscle stretches from fluid overload. The rhythm becomes erratic. Then suddenly, ventricular arrhythmia, cardiac arrest, instant collapse. The heart does not fail because it is weak. It fails because the blood chemistry becomes electrically lethal. The cleaner failed. The pump followed. The lungs, internal drowning. Your kidneys also regulate fluid balance. When they fail, water accumulates in the bloodstream. That fluid has to go somewhere. It backs up into the lungs. This is called pulmonary edema. The air sacs, meant to exchange oxygen, begin filling with fluid contaminated by metabolic waste. You are not drowning in water. You are drowning in your own unfiltered blood plasma. Breathing becomes labored, then frantic, then impossible. An oxygen deprivation accelerates damage everywhere else. The lungs are not diseased. They are overwhelmed. The brain, toxic betrayal. As urea and related toxins rise further, they cross the blood-brain barrier. This leads to uremic encephalopathy. The brain begins malfunctioning. Confusion, hallucinations, personality changes, delirium. Patients may appear psychotic, disoriented, detached from reality. This is not mental illness. This is chemical poisoning of neural tissue. Eventually, Consciousness fades. Coma follows. The quiet fatigue has now become a total systemic collapse. Act 3, the last measure. At this point, the body cannot survive without intervention, and that intervention is dialysis. Dialysis is not a cure. It is a mechanical replacement for one of the most mundane yet vital functions in the human body, cleaning blood. Several times a week, blood is removed from the body, passed through a synthetic filter, chemically scrubbed, and returned. What your kidneys once did silently, your body now needs a machine to survive. Dialysis keeps people alive, but it is time-bound, exhausting, and absolute. Missed sessions, and toxins rise again. Delay treatment, and organs suffer. This is dependence, not recovery, and it reveals the final truth. You don't die first from the heart stopping, or the lungs failing, or the brain shutting down. You die because the body's trash collector quietly stopped doing its job, and when waste is not removed, life cannot continue. The quiet death is not violent. It is not loud. It is what happens when something essential works perfectly, until it doesn't. In the human body, the most powerful organs are not the ones that create energy, they are the ones that perform the daily non-negotiable act of cleaning. But the quiet death is not always sudden. Sometimes it walks towards you for years while you go to work, answer emails, and tell yourself you are just tired. Because kidney failure comes in two main forms. One is acute, a sudden hit from massive blood loss, severe infection, a drug overdose, or a catastrophic drop in blood pressure. The other is chronic, slow damage from diabetes, high blood pressure, certain autoimmune diseases, and long-term overuse of some medications. One is an explosion, the other is erosion. In both cases, the end result is the same. The filters fail, and the body becomes a closed system with no exit for its waste. Inside each kidney, about 1 million microscopic filters called nephrons are doing the quiet work. Each nephron is a loop of tiny blood vessels and tubules that sorts your blood into two categories: what you absolutely must keep, and what you absolutely must lose. You are born with this fixed number of filters. You do not grow new ones. So every time one is scarred by high blood sugar, or damaged by uncontrolled blood pressure, or killed by a sudden shock, it is gone permanently. At first, your body compensates. Healthy nephrons pick up the slack. Filtration speeds up. You feel nothing. Doctors measure this capacity as glomerular filtration rate, GFR, how much blood your kidneys can clean each minute. At normal levels, your blood chemistry stays in a tight range. Salt, potassium, acid, water, all controlled with microscopic precision. As more filters die, GFR falls. Above a certain threshold, you will still pass urine. You will still believe you are fine. But the composition of that urine is changing. So is the composition of your blood. Early on, protein begins leaking into the urine. The fluid in the toilet bowl may look normal, but under a lab microscope, it is full of molecules that should never have escaped. That foam on the surface, sometimes that is protein leaving your body, molecule by molecule. At the same time, fluid that should have been excreted begins to stay. Ankles swell by evening. Rings feel tighter. Your face might look puffier in the morning. You call it water retention. Your kidneys call it a backlog they can no longer clear. Meanwhile, another quiet failure is beginning. Your kidneys do not just filter waste. They also release a hormone called erythropoietin, EPO, that tells your bone marrow to create new red blood cells. As kidney tissue dies, EPO production drops. Red blood cell count falls. Oxygen carrying capacity decreases. You become anemic. That strange, crushing exhaustion, climbing stairs feeling like a workout, shortness of breath from simple tasks. It is not just toxins. It is the fact that your blood is carrying less oxygen to every organ you own. Your skin may become pale. Your heart starts beating faster to compensate, pumping harder to deliver what little oxygen there is. The quiet death is no longer just chemical. It is now cardiovascular. And still, many people continue their lives. Coffee to stay awake, painkillers for the headaches, ignoring the early warnings. As GFR drops further, another system destabilizes. Your kidneys help activate vitamin D and regulate calcium and phosphate. When they fail, calcium levels drop, phosphate levels rise, and your bones begin to pay the price. Minerals are pulled out of bone to keep blood levels within survival limits. Over time, bones become weak, painful, easier to fracture. This is called renal bone disease. Your skeleton is quietly sacrificed to keep your blood chemistry compatible with life for just a little longer. At this stage, the quiet death is attacking your heart, your blood, your bones, your nerves, and still the main symptom you feel is, "I am tired." Deep inside, acid is also building. Your kidneys normally excrete excess acid generated by metabolism. Failure leads to metabolic acidosis. Your blood becomes more acidic than it was designed to be. To compensate, your lungs change the way you breathe. Breaths become deeper, more forceful, as your body tries to blow off carbon dioxide to drag the pH back toward normal. You might notice yourself breathing heavier at rest without having exercised. That is your respiratory system trying to fix a problem that started in your kidneys. The quiet death has now recruited your lungs into its damage control. But there is a limit to compensation. Once kidney function falls low enough, to a fraction of its original capacity, the timeline tightens dramatically. Potassium spikes dangerously. Fluid overload accelerates. Urea and other toxins climb quickly. This is the point where people appear in emergency rooms with swollen legs, fluid in their lungs, sky-high blood pressure, confusion, and blood tests that read like a chemistry alarm. When doctors say, "You need dialysis now," they are not exaggerating. They are telling you that your internal environment has become incompatible with continued life unless you connect yourself to an artificial filter. Dialysis does not restore dead nephrons. It does not reverse scars. It does not return the system to normal. It simply replaces, for a few hours at a time, the missing cleaning capacity. Blood is pulled from your body, sent through a semi-permeable membrane, bathed in a special fluid, and returned. Excess water, urea, potassium, acid, they move across that membrane and leave. You feel lighter after a session, less short of breath, less nauseated, more alert. But the toxins will build again, because the filters inside you are still gone. That is why dialysis must be repeated multiple times every week for as long as the kidneys cannot recover. Some people receive a kidney transplant, a donated organ that restores natural filtration. When it works, the change can be dramatic. Urine flow returns. Toxin levels normalize. Energy slowly comes back. Blood pressure stabilizes. But a transplant is not simply a reset button. It requires surgery, lifelong immune-suppressing medications, and careful monitoring. And not everyone can receive one. Not everyone has access to one. Not every transplanted kidney lasts forever. So for millions of people worldwide, the quiet death is kept at bay not by a cure, but by a regular appointment with a machine that stands in for the organs that stopped cleaning. This is the part most healthy people never see. They see heart attacks as emergencies. They see strokes as emergencies. They see accidents as emergencies. But the failure that forces you to sit in a chair for hours connected to an artificial filter just to stay alive, that is often invisible. To friends, to co-workers, sometimes even to family. Yet behind the numbers, behind the lab results, behind the medical words like uremia, hyperkalemia, acidosis, and encephalopathy, the reality is simple. You die because the body's trash collector quietly stopped doing its job. And when waste is not removed, life cannot continue. The quiet death is not violent. It is not loud. It is what happens when something essential works perfectly, until it does not. In the human body, the most powerful organs are not the ones that create energy. They are the ones that perform the daily, non-negotiable act of cleaning. And the next time you feel just tired, the next time your body whispers instead of screams, remember, sometimes the most dangerous failures are the ones that still let you walk around. Tap and subscribe to Dark Truth for more extreme body science before your own systems decide they have had enough.